Welcome, everyone, and happy BIPOC Mental Health Month. I am Dr. Shairi Turner, she, her pronouns, and I'm the Chief Health Officer here at Crisis Text Line. I'm an internist and pediatrician with expertise in trauma and public health. I currently lead the public policy and advocacy team, as well as the student learning practicum program here at Crisis Text Line. For BIPOC Mental Health Month this year, we are honored to have a discussion with Jon Brown, founder of Black Men's Health, on the important topic of empowering change, exploring generational stigmas in Black men's health. Joining us as well is Ricky Neal, our Senior Manager of Growth Partnership at Crisis Text Line. So before we get started, for those of you who are new to Crisis Text Line, we are a free 24/7, high quality and confidential text-based mental health support and crisis intervention service. We have trained over 74,000 volunteer crisis counselors, and we serve both English and Spanish speaking texters as we're bilingual and bicultural. You can reach Crisis Text Line by texting BMH to 741-741 in your time of need. So, Jon, I'd love to start with you. If you could tell us a little bit about yourself and discuss your critical work with Black men's health and why it's important.
Yeah, thank you, Dr. Turner, for having me, and thank you for the amazing work that you and your team do at Crisis Text Line. Black Men's Health is really a movement that I planted a seed for in 1999. It's really about our focus on creating more balance through health for men of color, specifically Black men and those who love and care about Black men. And we approach it very broadly, very holistically, touching the whole man, right? Reaching the whole man and the communities that we are in. So mental, mental, physical, spiritual, financial, and social, those areas. And if you would have asked me this, 3-4 years ago, I probably would have led with physical. While physical health is very important, maintaining our temples and watching what we put in our mouths and our systems and things of that nature, mental health is critical. And as the partners that we have related to mental health always remind us, NAMI and other partners, that without our mental health, we don't have health at all. So it is critical work. We have unfortunately lost so many lives and young lives to challenges related to mental health. And if we could just do the work, focus on creating more access and awareness, then we would have done never enough, but we would have done our part to at least work to break these stigmas. So thank you for allowing me to be in this space with you, Dr. Turner.
Thank you for being with us today, Jon. And thank you for your important, meaningful, and passionate work. It's clear that this is a passion for you. This is a mission for you. And we're excited about this new partnership with Black Men's Health to provide a critical resource to Black men who are seeking mental health support. Now, Ricky, can you talk about your role at Crisis Text Line and how every day as you help to build partnerships, spread the word, the importance about seeking support, but why is this really important to you as a Black male of your generation?
Yeah, thank you for that question, Dr. Turner. And before I jump in, Jon, I just want to say thank you for the crucial work you're doing. Truly, thank you. It's very important work that you're doing. So at Crisis Text Line, I sit on the corporate partnerships team where we help corporations meet their mental health and wellness goals. I mainly focus on verticals like sports, influencers, and small to mid entertainment brands. And so we are constantly exploring ways to support high-need industries like the construction industry, where we see very high suicide rates compared to other industries. Some of our partners include Major League Baseball, NBA Mind Health, and even Nike. And this is important to me because Black communities, we often face disparities in mental health care access and quality. By working with influential partners that Black men love and trust in sports, entertainment, and other industries, we're helping to reduce these disparities and ensure that mental health support reaches those who need it the most.
Thank you, Ricky. I love that your work here aligns with your personal priorities, and it's just evident how meaningful it is as you continue to help us to develop these critical and important partnerships. So when we talk specifically today about mental health stigma, we know that historically Black men have faced significant challenges due to long-standing barriers that really span the generations. And these barriers can range from narratives about being strong providers who can't afford to demonstrate vulnerability to a lack of access and distrust of providers who don't look like us and thus may not necessarily understand the impact of racialized trauma and daily microaggressions on mental health. So, Jon and Ricky, can you share any challenges that you may have faced in seeking support for your mental health or supporting other Black men in doing the same?
Yeah, I'll start. And again, Ricky, thank you for, again, allowing me to be in this space with your brother. Anytime I get to share this space or any space with brothers where we're doing this work, it's critical work, and it's always good to have counterparts that are doing it. One thing about that, Dr. Turner, continuing to realize that while this is not a unique scenario at all for me, right? I'm in these spaces all the time doing this work. In many cases, when we're having these discussions, it could potentially be a very unique situation, right? Ricky and I on the screen having this discussion in some environments is very unique. We are unicorns. This is not happening. So you said it all, Dr. Turner, including the microaggressions, which sometimes I can just remove the micro and get into full-blown aggression, right? So, but you spoke about the stigmas, the generational challenges related to our fathers and our grandfathers, and rightfully so, right? The mistrust and distrust, and rightfully so. So many things our fathers and grandfathers had to deal with for protecting us and protecting their families and our communities. And while we absolutely are in a different space now in 2024, some of these challenges still exist, right? And us just navigating the world as Black men can be a challenge in itself. So again, back to access and awareness, making sure that brothers understand that they are not alone, that they are not on an island, that they are not the only people or only person that are having these challenges. I think is super important that we just make sure that we continue to have these discussions and continue to make sure that brothers know. Even a lot of times we talk at the end of our discussions about making sure that brothers understand how to gain access to resources, and in whatever community you are, whether it be a telephone number or a website or a mental health professional, just guiding brothers in the right direction and making sure we continually talk about these things to normalize them. So when brothers do need help, whether it be critical or crisis or even small challenges, that they know they can move forward and should move forward, and there's a community around them to support them in this.
Yeah. Ricky?
So I would definitely say one of the biggest challenges is finding great therapists who look like us, especially in the Southeast region of the US. Not only are they a challenge to find, but they are typically booked out for months in advance, or they're just simply not accepting new clients. So the need for Black therapists is clearly there. And I will also say that education is a key component. So the community I come from is simply not equipped with the language or the education to discuss mental health. So talking about it is practically non-existent, and most people cope by drinking, smoking, or humor, and it's hard to break the mental health stigma when people simply do not want to talk about it. Overall, we need more therapists that look like us, and we need culturally relevant education in order to destigmatize mental health. Education that empowers people to have difficult conversations is crucial.
Yeah. Thank you, Jon and Ricky, for your vulnerability. Yeah. You raise such good points, and access and the narratives that we carry, right? It's throughout each of our mental health journeys, the mental health journeys of our families. And we know that members of the Black community who are texting us at Crisis Text Line are experiencing these challenges, challenges around access to care, access to services, like Ricky mentioned, and then challenges around their sense of well-being, just existing as Black people in this country. For us, after our texters receive support from our volunteer crisis counselors, they're offered this link to complete an anonymous and confidential post-conversation survey. And it includes questions about demographics, the issues that were discussed during the conversation. And from this survey, we're able to aggregate our insights and provide an annual United in Empathy report with this information. So I want to take a moment to share with everyone what we know about Black and African American male texters. One of the things that stuck out to me was the need, right? So we know there's a need in the Black male community for services, but right now, only 2% of Crisis Text Line texters are Black or African American boys or men. And they only account for 2% of our total conversation volume, which again is why this partnership is so important, because Black men's health is going to be another avenue to get Crisis Text Line out as a resource. So what do we know? We know that over half, or 50.1% of Black or African American boys that contacted us in 2023 were between the ages of 14 and 24. So we're again appealing to younger people, digital natives who feel comfortable talking about their concerns, their issues, their struggles by text, which makes sense. 33.2% of Black or African American boys and men were in the 25 to 44 age range. 8.5% of the Black or African American boys and men were over 45 years old. 8.2% were actually under 14. So happy that it's a resource, but then again, just speaking to, the number of young people who are in crisis at these younger and younger ages. When we look at the topics of discussion, there were leading topics that I'm going to go into that Black men and boys discussed. They were similar to what our Crisis Text Line texters discussed. However, we saw that many of these topics were more prevalent among Black men and boys. So, for example, anxiety and stress. 38.4% of our Black male texters texted in about this topic, as compared to 34.7% of the general Crisis Text Line texter population. Relationships, 34.8% of the issues were around relationships. 30.4% were around depression and sadness. 20.5% were focused on isolation and loneliness, as compared to 17% of the general population, Crisis Text Line texter population. And then suicide was discussed by Black or African American boys at an average of 19.2% of the conversations, while the Crisis Text Line average was 17.9%. And lastly, interestingly, self-harm was less frequently discussed by Black males at 7%, as compared to the Crisis Text Line average of 13.3%. And our research also showed that over 70% of the Black texters stated that reaching out to Crisis Text Line was actually the first time they had accessed mental health care. So that's a huge number. That's telling us that so many people are in need. They're finding Crisis Text Line. But again, we need to continue that outreach, to continue to ensure that Black men know that and boys know that Crisis Text Line is a resource, because we see by those numbers that there's still a lot of work to be done in getting this word out to the Black community. We know also many of us have been taught to be strong, to endure, to keep our struggles to ourselves. And this too makes it difficult to reach out for help when we need it most. So I again want to reinforce Black Men's Health as a resource, as a partner here. And anyone can text BMH to 741-741 and reach a volunteer crisis counselor, confidential, free, 24/7. So Jon and Ricky, again, can you share how you support your own mental health, and what are some of the resources that you utilize?
So for me, faith is important, right? That's not something I will push on anybody. But for me, very important, something I'm grounded in, and that helps me, right? A bigger cause, something bigger than myself, and that's some consistency for me. Family is important for me, and in that family, there's peace, or there's not peace with family, right? But for me, I choose, especially with my relationship with this beautiful woman in my life, my wife. The more in sync we are, the more peace there is in our lives. So that's critical. And we, again, blessed with three young men, and we do our best to keep up. That can be challenging at times. I also say my brothers, right? And when I say my brothers, I'm talking about my nucleus, my real brothers, right? I shouldn't say real, my blood brothers, right? I'm one of four. That's critical. That is my base. That is my foundation. My boys, when I say my boys, I'm talking about my kind of day ones, the cats that I grew up with since the, second grade, since the sixth grade. I just had a breakfast yesterday with two of my boys. We are intentional about that. Because it won't happen. We're all too busy to just make that happen. So we have to make that happen. My fraternity brothers, my line brothers, my community, men in the community that are important to me, and we stay connected. My mental wellness and controlling what I can control, specifically my schedule and my calendar. I can't do it all, but those things that I can control, it helps create some mental wellness for me. And also for me, getting active. My wife woke me up and said, "We're running this morning." That was not a choice I had, Dr. Turner, but we were running this morning. If I can stay on that, that's obviously helpful to kind of get the body moving, get the mind moving, swimming, chasing these three boys around. And I already told you about chasing this beautiful woman around. That's important to me. Getting away when we can, and I know that's not always feasible for everybody financially, but getting away doesn't have to mean a vacation to Mexico. Getting away could mean just getting out of these county lines and gaining some perspective and some empathy, because the world is bigger than these the city or the county that you're in, and staying connected to professionals. I mean, really, as we said, making sure that I'm aware and other brothers aware that we can gain more, have more education, more awareness, more insight, more information about how to do well for ourselves, how we can stay strong mentally, and also when we have challenges, the resources we can get to and share with others.
Ricky.
Yeah, thank you for that. So, Jon, you definitely touched on a lot of things that I can agree with. I mean, faith being number one, it really helps keep me grounded there. The one thing that I can disagree with you on is traveling within county lines. I'm all about a good international flight when I can, and not just so and I want to recognize my privilege in that, and so it's when I can get away, I love to get away and experience different cultures and just eat different foods and things like that. Being with my family, I have three amazing nephews that I love spending time with, and being outdoors with my chunky English bulldog. And I make sure I strategically plan all of these things to give myself something to look forward to. Additionally, I set really strong boundaries as well. So if there's a place that I do not want to go or an activity that I do not want to do, I simply don't do it. There's no explanation for anything. I just won't do it. But this really allows me to focus and dedicate time to the things that truly bring me joy.
I love that. I love hearing sort of the different stages of your lives, right? And how you incorporate similar things, faith, family, travel, into your mental health and well-being. And Ricky, I want to highlight also the importance of boundaries for everybody, right? Because I think too often we get pulled into situations or asked to do things that just don't resonate for us. And it's really important that we feel okay with defining those boundaries. So I was so happy to hear you say that, and just really excited about the way that each of you supports your mental health. And I think that's a key point, because it's about the individual, right? It what makes you feel supported, what makes you feel resilient, as opposed to what anyone else is doing, right? Because we're all individuals, and it's so critical to ensure that we're doing the things that support our own mental health and well-being, and finding the tools in that toolkit. And your toolkit, Ricky, and your toolkit, Jon, are going to be slightly different, but it's important that we each have something there to reach for that we know will help bring us peace and calm. So I get asked this question all the time: how do we break the stigma or break the silence? And today, I hope we really took a step in that direction, because it's ever so important to talk openly about mental health, like we just did, about sharing our feelings and experiences, and how we lean into family and friends. And you never know how many other people are going through similar struggles. And just seeing and hearing that you all reach out for mental health support from friends, from family, that we're all looking for the good therapist to help, because our mental health is just as important as our physical health. And finding that therapist to keep us healthy before we get into a crisis situation is really important and key. So, as we close, again, thank you, Jon and Ricky, for just your honesty, your vulnerability, your transparency with us today, and giving us insight. You are two Black men, two different generations, but you both elevate the need and the importance of reaching out for support. So we hope truly that this conversation will help others who are thinking about whether they need help, and encourage them to reach out for help. I want to just let people know also that at Crisis Text Line, not only are we here as a resource, but we're always looking for empathetic people to become part of our volunteer community. We know the research shows that volunteering actually helps mental health and well-being. And we have an online training for our volunteers that's self-paced, and available if anyone is interested. And you can really make a huge impact by helping others. So I'm making a call out to Black men who want to support others through Crisis Text Line. And you can visit crisistextline.org/become a volunteer to learn more and apply. And lastly, everyone can reach out to us for support by texting BMH for Black Men's Health to 741-741. And our volunteer crisis counselors are here to support you. We are free. We are 24/7. Confidential. No one has to know. We are available on your phone at any time, day or night. So you never, ever have to feel alone. So thank you, Jon. Thank you, Ricky. Thank you, everyone, for joining us. And hopefully we see a path together, not just during BIPOC Mental Health Month, but every month of the year, when everyone receives the support that they need. Thank you.